Another tip is to ask one question at a time. Individuals with Alzheimer's disease many times are unable to process multiple questions or a multiple step command. It's important to break things down simply for better communication. Another thing that you can do to communicate is to avoid vague statements. Instead of, "Come here with me," say, "Come to the kitchen with me." Be very specific on where you're going or what you want them to do versus using vague statements. Another thing that you can do for the person with Alzheimer's disease is not talk about them as if they weren't in the room. If you're talking to a loved one who's visiting and they're asking how your loved one is doing and they're sitting right there, don't just talk about them like they're not there. Include them with your situation in your conversation. And then another key thing to do is to use unspoken communication, like pointing. Sometimes they might not be able to understand your words, but if you point to something like the plant over here that we just got, or our dog, and point to the dog, then they can understand what you're saying. Another tip for communication is to be flexible and understanding. Individuals with Alzheimer's disease might get very frustrated as they're trying to express themselves. So be flexible, and if they can't get the words out now, maybe later in the day they can. Now I will talk about how to manage your stress. 10 ways to be a healthy caregiver. Now, are you so overwhelmed by taking care of someone who is dealing with an illness that you have neglected your own physical, mental, and emotional well-being? If you find yourself without the time to take care of your own needs, you may be putting your own health at risk. The first thing that you need to address in managing your own stress and being a healthy caregiver is to understand what's going on as soon as possible. If you're unsure about your loved one's diagnosis, please, visit a physician and get the diagnosis as soon as you can so you can understand what is going to come in the future. The second step to being a healthy caregiver is to know your community resources. It's very important to know that there are many things that can assist you as you are caring for your loved one. There are many associations available to help, whether it is the Alzheimer's Association, Cancer Society, hospice, the Area Agency on Aging. There are so many resources that are available that can direct you to services that you may be unaware of in your community. Even your local library can direct you to a variety of services that are able to assist you. The third step is to become an educated caregiver. You need to educate yourself about the disease or condition that your loved one is going through, because if you know more about it, you're going to be able to cope with it better. The fourth way to be a healthy caregiver is to get help. We all think that we are the best caregiver and that we will be the individuals that can give the best care to our loved ones. But if you rely solely on your own ability to care for your loved one, you'll be wearing yourself down. It's important to ask for help. Many times individuals say that they'll help, but many caregivers don't ever call and say that they need it. So take a step forward and ask your neighbor, ask your family, your friends, your church group to assist you as you are caring for your loved one. The fifth step to being a healthier caregiver is to take care of yourself. Getting a break, doing things that you like to do, that you used to do, things like that can make it easier on you as you are caring for your loved one. The sixth sign to be a healthier caregiver is to manage your levels of stress. You can use certain relaxation techniques, whether it's yoga or meditation or a variety of other things. For some caregivers, taking a walk, out in the air or just taking a break can help to manage your levels of stress. The seventh thing that you can do is accept changes as they occur. Many times with a variety of illnesses, they may be terminal. And as you are, your loved one is progressing in the disease, it may be difficult to deal with the changes that they are going through, whether then they're unable to do certain things that they always helped you with. You need to accept those changes as they occur and then find other ways, whether it's relying on someone else or asking for assistance as those changes do occur. The seventh thing that you can do is to make legal and financial plans. If this disease is terminal, you need to make these plans early on, while your loved one is able to possibly be aware of what's going to be happening in the future and let you know about their wishes for the future. Another way to be a healthy caregiver is to give yourself credit, not guilt. Know that the care that you provide is the best that you can do. Don't beat yourself up and say, well, I should have, I could have, I would have. You're doing the best you can with the situation that you're in. And the 10th way to be a healthier caregiver is to visit the doctor. Get regular checkups for yourself so you can ensure that you can be a healthier caregiver. The Alzheimer's Association has these 2 brochures that I have here today with me for free to individuals who are caring for people with Alzheimer's disease or related disorders. Caregiver Stress Check is a quiz that asks you questions about different things in your daily life that may indicate that you do have caregiver stress. The check is also available on our website at www.alz.org. And then the other brochure, 10 Ways to be a Healthier Caregiver, is the information that I have gone over today. Please also give us a call at 1-800-272-3900 to access any of our other information. Thank you for taking the time to listen to me today. Please also take a chance to view other segments of this DVD if you have not.